heart, or we can simply say the chambers of the heart. The heart is internally divided into 4 chambers, and a longitudinal interventricular septum separates the right and left side of the heart, and the transverse septum separates the arteries from the ventricles. Arteries are the receiving chambers which receive blood from the body, and ventricles are the pumping chambers which pumps blood to the body. Okay, so the atria. The heart has 2 arteries, left and right, which act as the blood receiving chambers, and these are positions dorsally at the base of the heart and structurally adapted to collect blood returning to the heart from the body. Right atrium and left atrium and lungs. Left atrium. So the right atrium receives blood from the body and left atrium receives blood from the lungs. Location and general structure of the right atrium occupies the right dorsocranial portion of the heart base. It is composed of 2 portions: sinus, venarum, cavarum. It is a smooth walled main chamber. Right auricle. It is a blind-ended pouch-like extension for the muscular ridges. Okay, the blood supply for the right atrium. The right side of the heart contains a deoxygenated blood. The right side it receives the deoxygenated blood from the cranial vena cava and caudal vena cava. The cranial vena cava drains blood from the head, neck, and forelimbs. The caudal vena cava drains blood from the abdomen, pelvis, and hind limbs. The coronary sinus, the heart vessels of the heart that transfer the blood to the heart are called coronary vessels, and coronary sinus it collects venous blood from the myocardium of the heart. Myocardium, the heart muscles itself. Internal features: intra-arterial septum. It separates the right side of the atrium from the left atrium. Intervenous tubercle, a transverse ridge between the opening of the cranial and caudal vena cava, deflects the inflowing blood towards the arterioventral orifice, helps in a smooth flow into the right ventricle. Oval fossa, depressed region of the interarterial septum, located in just caudal to the intravenous tubercle. The remnant of the foramen oval of the fetal development once allowed the blood to bypass the non-functioning fetal lungs, but it doesn't work anymore. Musculi pectinati. The prominent parallel muscular ridges found inside the auricular. It helps reinforce the arterial wall and increase the contractile force without thickening the wall. Left atrium. The left atrium, general location and structure of the left atrium. Located at the left and dorsocranial part of the base of the heart. Like the right atrium, it is composed of main smooth wall chambers. Left auricles, the left auricles. These are the muscular and ridge-like its right counterpart. Blood supply. As we know, the right side of the heart contains the oxygenated blood, so it receives the oxygenated blood from the heart through the pulmonary veins, usually 4 to 6 in domestic animals, which opens separately into the atrium. Internal features: interarterial septum shared with the right atrium. It enters to the left ventricle via the left arterioventricular opening. The opening of the pulmonary veins are not guarded by the walls. The walls of the left atrium are generally thicker than the right due to the slightly higher pressure. So this is the summary chart of the right and left atrium.